There's an area of the face that we all struggle with. It's called the tear trough. It's the lower eyelid area. It's a very important area, but there's a bit of a debate about the best way to address this area. Let's check in now with Dr. Restivo. So what do you believe is the best way to rejuvenate this area? Is it non-invasive or is it surgical?
Well, obviously it depends on the particular patient and what the patient's anatomy is and what the patient's goals are. Some patients will clearly need a blepharoplasty, but some patients will be well served by injectables.
So you talk to the patient, you decide based on the patient's individuality then?
Yeah, treat each patient as an individual, but the thing about injectables is they're low risk. They go away after time, and it gives the patient a chance to try something, and if it doesn't satisfy them, they can go to the next level, which would be surgery.
Well, the tear trough is finally getting the attention that it deserves. There's a difference between the eyelid and the cheek, and the tear trough represents that junction. Two things can happen. One, the fat pads can make the lower eyelids puffy, and that causes a shadow. The mountains shadow the valley, or you can lose cheek volume, and there's a relative difference. So filling up the valley to the top of the mountain makes that lid-cheek junction much more smooth. Now, some patients who clearly need blepharoplasty surgery, who have puffy lower eyelids, weak muscles, wrinkly skin, we can mask that need for a blepharoplasty with a filler, which are again very safe. And the neat thing about fillers, they're erasable, so we can get rid of that. So a patient can kind of test the waters to look more youthful, to look actually more healthy when they get rid of that hollowness below the eyes without having surgery, but it is by no means a definitive answer for that area of the face.
Can you go overboard though with the fillers?
Oh, absolutely. There's a subset of patient that for whatever reason will never have surgery, and they will continue with fillers and fillers beyond the point at which they look good. And we've all seen those patients that are overfilled. So yes, you can definitely overdo it.
Adding volume is not the answer to skin laxity, and that's where we get that filler face that you see on the red carpets.
Right, that's what you have to be aware of, because we
Absolutely.
all agree that does not look good.
Absolutely.
For all your plastic surgery answers, visit theplasticsurgerychannel.com.